Good morning, afternoon, or evening, everyone. My name is Jonathan Dayton, the Executive Director of the Maryland Rural Health Association, and we're back with another podcast, The Voice of Rural Health. I have two wonderful guests on. I have Lance and Chris with me from WellCheck, and I'm going to let them talk about WellCheck. They know more about it than I do, working in the field every single day. So, Chris, I'm going to turn it over to you for an introduction.
Morning, Jonathan. Thanks for having us. Chris Nickerson, WellCheck, joined by my partner, Lance Cassell. Excited to be here. Just a quick intro for what WellCheck, who we are. Based out of Baltimore, we're a health equity technology company that really focuses on underserved communities and supporting their coordinated care. Work with health departments, providers, community-based organizations, building a secure platform to connect community members to needed resources. So, as I said, we're based out of Baltimore, Maryland, but we touch all parts of Maryland. So we're happy to be here today and walk through some of the things we've learned throughout our tenure.
Thank you for the introduction. And we know that I think rural Maryland has a lot of health equity gaps. There's a lot of issues there. And I'm curious, from your standpoint and with your solution and company, how we could be solving some of those health equity gaps and issues within rural communities across the state.
Great question. I think that, for starters, what we've seen and learned and with our, working with our partners, a lot of the times we hear that they're tracking a lot of these programs. They're doing such great work in the community. For example, AHEC West, and they're doing such great work in community, but before their need was really how do we track the effectiveness? How do we keep track of our community members with the resources that we're providing and being able to do that? So providing a system that centralizes that information and really helping them with the coordinated care allows them not only to keep everything centralized and organized, but also increases their effectiveness, right? So they're able to touch more people with one central database, versus having to manage different grant programs, different initiatives on different platforms. So I think that's a key, right? If you're looking to expand, I know that there's a lot of funding coming to the rural parts of Maryland. Just what we've seen out there that works best is finding a centralized platform to help. Starting there is a great jumping off point.
Lance, is there anything you'd like to add, Lance?
No, I mean, I think that was well done, well covered. I mean, I think the shared infrastructure that WellCheck's been able to enable for a number of our clients, both on the Eastern Shore and out in Western Maryland, has really helped them move the needle as far as coordinating care. And that's kind of how we like to look at it is, this is not just software. This is an infrastructure that we're creating and then allowing, partner organizations to share with their resources.
And tell me a little bit about how this works, right? And so, when we look at things through a health equity lens, we want to fit it into real world workflows. So, folks are busy, clinicians are busy, community-based organizations are busy. I think that we've been doing things very old school for a long time. We've been, Excel spreadsheets, and you kind of said it best before when we were talking that, things can't live in spreadsheets because they need to reach the patient. And so when you look at your software, for the listener on here, tell us just a very brief overview of how that works for an organization that utilizes WellCheck.
I think that, yeah, sure. I think that part of what what we're seeing in these community-based organizations, these local health departments, local regional hospitals are they're trying to reach as many of their community members as possible, while also, they've got grant reporting they've got to do, they've got metrics they've got to meet, and if you're bogged down with spreadsheets and filling those out post facto, right? You go into a community event and then having to go back to the office and fill out all the, all the paper forms. It just gets cumbersome. Whereas you can hit a QR code, get the, basic demographics, get the information you need for the grants, and get the services to the individual as quickly as possible is really what the infrastructure really helps speed up that care, speed up those resources, and providing them in just in time. I think that's it. Otherwise, filling out spreadsheets and it just administratively it just and they're spread thin, right? They've got these wonderful community health workers. They're out in the community. They don't have a whole lot of time to be doing a bunch of administrative work, and having a digital platform that they can leverage quickly, easily, and effectively, I think is just makes their life, their jobs that much more impactful and more, that their reach much more larger.
Absolutely. Reach and impact is huge. How can we reach the most people in an efficient manner? And I think efficiency is a big word here too, making things easier for, these community-based organizations. And you mentioned just briefly a minute ago, kind of AHEC West. I think that you're doing some wonderful things there. I know a little bit on the back end on my side, but for the listener, they don't know what's going on there with AHEC West. Do you want to touch on that partnership so the folks understand, kind of a real world solution, what you're working on there?
Wonderful. Yes, I think that, for AHEC West, it started with that, as I'd mentioned, what their real needs were, centralized, a single system, a single platform to just centralize these wonderful programs. And again, they've got a bunch of programs that are working that are also supported by multiple different grants. So we see this time and time again across, all across the state. And for these organizations that are doing that, they're trying to manage these programs. Data is important. Data is so important these days, and being able to report out, referrals, check-ins, all of that. Creating a closed loop referral system is key. And the beautiful part that, we've been working with AHEC West over a year and a half now, and, helping them with that process. But what we've seen is taking place is now it's growing. That ripple effect is they're now pulling in other community partners to help with this shared single system, right? It's Western Maryland, they're not providing all the services. So those key partners that AHEC West has are so key with just really providing care and being able to hand off that referral in real time. Is We've seen it in action. They made such an impact. They've got really close partnerships with their folks out there. So it's been a wonderful partnership.
Anything like you'd like to add, Lance?
Yeah, sure. I mean, they've, like Chris said, been great partners to work with. I mean, they've pushed our line of thinking on things. I mean, we can build. Chris says it all the time, and we can build anything. It's just a matter of understanding what we're trying to solve for. And they've been great at sort of laying out the issues, and been great just working on building the platform out. And what the problems that they're trying to solve. So.
And we're in, an interesting time frame where, we've done a lot. I was involved in a lot of screening for social determinants of health initiatives back in my former job. And, I think that the important thing is, when you screen somebody for these issues and concerns that they have, it's about delivering them the right next step of care, right? Whether that's getting them connected to, social services or a primary care physician or a specialty care provider, or is it something they need help with food insecurity, right? And so closing the loop is where, things actually happen and make sense. And I think that for a lot of folks, trust is a big factor, and they want to see that loop being closed where, where they take a screening, they take a survey, they're actually going to see results in the back end to make their lives, better and make their lives healthier, right? I think that's a big thing. I think that's where your technology comes into play. Am I correct when I say that?
You're spot on. And I think that, Interesting stat, over 50% of paper referrals never go under, they just fall off and never get followed up on. So I think being able to screen individuals in real time, and it's not just what we've seen in the marketplace and what the needs of our partners are. It's not just a one screening and you're finished, right? I mean, everyone's situation may change, could be seasonal, could be, work related, but to screen at a point in time is one thing, but building, having a system that can do that on a regular basis, especially for community members that have been identified as needing a little bit more assistance, needed more check-ins. I think having a system that allows you to push send and reaching out, that connectivity, to your point, it builds that trust, right? You care about me, you're checking in on me. And then having the infrastructure to then refer them to the needed service. I think the repetition of that constant reach out, you know, don't get me wrong, the care coordination and the community health workers do a phenomenal job, but also having technology to help with that and aid in that reach and those touch points, I think are critical. And then flagging those areas, those social drivers or social determinants of health that are of concern, and tracking that progress, right? I mean, some of the questions are, yeah, sometimes I'm having issues with food security, and being able to, treat that as and do something with that data, I think is so key. And it also builds trust and builds that connectivity to our partners like AHEAD West.
Yeah, absolutely. And, I think that, we talked a lot about partnership building and connectivity. And I think that collaboration is another big word in the space right now. I think that we can't go at these issues alone. We need to go at them together. I think that's for the betterment of the patient, the betterment of the clients. And I think we're at a very pivotal moment, right? Here in the state of Maryland, but across the country, even up and down the Eastern Shore, right? Rural healthcare is an issue that I think brings us all together. I think that we all can collectively understand that rural communities have big challenges ahead of us, and it's time to invest in innovative solutions and programs. And I'm big on innovation, big on technology. I think that that's the way of the future, but I also think that those make our life easier, but help us to better reach pockets of populations that are underserved. And I think that that's where we're headed. So, as the listeners on here are kind of wrapping up the podcast, what are some last minute thoughts you have on, not only your solution, but the trajectory and the future of rural healthcare here in the state of Maryland?
Yeah, thank you. The future is very exciting. I've seeing the transformation fund and watching those dollars, or hopefully watching those dollars really get into these local communities. We say it all the time. I mean, having an infrastructure that is hyper local, I think, is key, and then also being able to track and measure those local outcomes are key. And I think that's current state of state. From a technology partnership perspective, we get that question all the time. Like, hey, I've got this. I was able to, secure this food insecurity grant, and I need help just being able to deploy that and then measure the outcomes and the impact. So being able to find, partners and technology that allow you to do that, I think, not only, because we've seen it, with the HERC grant and the Pathways grant, and now, as it continues to, they want to see the progress, they want to see the impact, and having that really provides for sustainability for these programs. I can't say it enough, and it's exciting. It's exciting to be a part of these initiatives, and we're looking forward to 2026.
Lance, anything you'd like to add?
No, I'll leave it there. Well said and summed up.
Well, thank you both for being on the podcast, and we'll make sure all your information's in the description. But yeah, I think that we had a really good conversation here on not only the solutions that WellCheck can bring to communities that are rural and underserved, but across different healthcare organizations. And so I look forward to seeing what all the work that you both are doing with WellCheck over the next year, and I look forward and I'm excited for the future of healthcare in the state of Maryland. And I know this won't be our last conversation, but if you're listening on here, thank you for listening, and I hope you tune in next time.
Thank you, Jonathan.
Thank you.